All right. Hi, my name is Zach Google. I'm a second-year student in the Doctorate in Athletic Training at Indiana State University. Today I'm going to be discussing and demonstrating the SI joint mulligan with movement, posterior rotation correction technique. So just a little bit about this technique. So we want to do this for a patient who has a posterior rotation of the SI joint. And this technique is really going to be good for immediate pain relief. Mulligan with movement, one of the staples of their techniques is providing immediate pain relief. So the objective here is to give the patient immediate relief of pain, and then also we're going to provide an anterior glide to the affected side in hopes that we can take that posterior rotation and move it anteriorly, which should help in the correction. So I think this is really valuable before the patient does rehab exercises, so we can get them in as close to neutral as possible to allow the exercises that we select to be effective. So to start off, we're going to have the patient in a prone position. The clinician needs to be adjacent to the affected side. So, so for our patient here, their right side is going to be the affected side. So I'm going to stand on the opposite side. The landmarks that we need to think about here is the PSIS. So palpating that is important. So the clinician needs to take the palm of their hand right over top of that PSIS. Then I'm going to, I find it most comfortable to kind of interlock my fingers almost as if I was doing CPR. But I'm going to be over top applying a downward pressure. So clinician doing this, it's important to take into consideration the height of the table. So if you're a shorter clinician or you have a higher table or both, it might be a good idea to find a stable box to stand on to give you enough leverage. Of course, ideally, it would be nice to have a table that we can control the height so we can raise and lower it. So we want to just make sure that we are directly over the affected side. So I have my arms locked. And then what we're going to do is we're going to tell the patient to kind of get in a push-up position, starting in the down position, like Jordan is here. Once I've located the area where my hands need to be, I'm going to instruct the patient to press up in a pain-free range of motion for approximately 1 second and then go back down. Okay, go ahead. And again. And one more time. Good. So what this is doing is allowing the patient to move in a pain-free range of motion, which is one of the hallmarks of a mulligan with movement technique. And then my body weight, my upper body weight, is over that affected side, and I'm applying an anterior glide by having her move up towards me. So again, this is going to be really valuable for somebody who has pain in this area, and we're looking for some pain relief so we can continue to do exercises and treatment that's going to be effective. Thank you.